Assalamualaikum and a very good evening to everyone. My name is Nur Shazana Arif and I'm truly honored to stand here today to present something very important, something that goes beyond textbooks and lecture halls, and that is mood disorders. This topic isn't just a theory in our textbooks, it's real, it's life in people we know, friends, family, maybe even in ourselves. And that's why today we want you to not only listen but feel the importance of this issue, because mental health matters just as much as physical health. Mental health is a vital part of overall well-being, and understanding mood disorders is essential for both personal awareness and professional practice. Together, we hope to raise awareness and help all of us understand the reality behind mood disorders, especially as young people in a high-pressure environment. To start, I'd like to share a quote that really touched me. It's by John Green, an author who often writes about mental health. He said, "There is hope even when your brain tells you there isn't." And that, I think, captures the heart of mood disorders. Because for someone going through depression or bipolar disorders, the biggest battle is not always outside, it's inside. So, what is mood disorders? Mood disorders are a category of mental illnesses that primarily affect a person's emotional state. This means their day-to-day mood is disrupted in a way that's intense, long-lasting, and difficult to control. They involve intense feelings of sadness, hopelessness, or on the other end, excessive excitement or irritability. We all feel sad sometimes, or overly excited. That's normal. But for someone with a mood disorder, those feelings don't just come and go. They stick around, they take over. Imagine waking up every day feeling like you're drowning in sadness, or having so much energy that you can't sleep, think, or stop talking. They are not moods that pass in a day or two, they become part of someone's life. They persist over time and often interfere with daily life, work, relationships, and self-esteem. And it's more common than we think. According to World Health Organization (WHO), over 280 million people globally suffer from depression, and those are just the ones who are diagnosed. These conditions are caused by a mix of biological, psychological, and environmental factors. It can involve chemical imbalances in the brain, a family history of mental illnesses, past trauma, or even chronic medical condition. There's one quote that truly captures the intensity of what some people go through. Dorothy Rowe, a psychologist, said, "Depression is like a war. You either win or die trying." It's raw, but it's real. Mood disorders are not simply feeling down. They are battle fought inside the mind. Every day, every hour. It's a powerful reminder that for many people, battling mood disorders is a daily fight that deserves understanding, support, and compassion. Now, let's look at the main types of mood disorders. Each one affects people differently, and each one deserves to be understood. The first is major depressive disorder, or MDD. This is what most people think of when they hear depression. Someone with MDD feels deep sadness, hopelessness, lack of energy, trouble sleeping or eating, and may even have suicidal thoughts. Second is bipolar disorder. This is a condition where a person experiences extreme highs, called mania, and extreme lows, called depression. During mania, they may talk fast, sleep very little, feel like they're invincible, and make risky decisions. But then, they crash into a depressive phase which can be just as intense. The third is dysthymia, or persistent depressive disorder. This is a milder but long-term form of depression. Imagine waking up every day feeling emotionally numb, not sad enough to cry but not happy enough to live fully. This can last for 2 years or more and often goes unnoticed. There are also other mood disorders that are just as important to recognize. Seasonal affective disorder, or SAD. This typically occurs during winter when there's less sunlight. People feel low, tired, and unmotivated during colder months. Next is premenstrual dysphoric disorder, PMDD, a severe form of PMS that causes mood swings, anger, and depression before menstruation. It's intense and affects daily functioning. The third is substance or medication-induced mood disorder. This happens when alcohol, drugs, or medication causes emotional disturbances, cause extreme changes in mood. And the last one is mood disorder due to a medical condition. Sometimes physical illnesses like stroke, Parkinson's disease, or thyroid disorders can directly affect a person's mood and cause depression or mania.
Hi everyone, I am really happy to be here with all of you today. As someone who used to be in matriculation myself, I know how stressful this phase can be. That is why I really want to talk about something that we do not always give enough attention to, which is our mental health, especially mood disorders. First of all, why is this topic important for you as students in matriculation? The answer is simple because your mental health affects everything from how well you study to how you feel about yourself and how you interact with others. Let me explain a few key points. First, mental health during studies. Academic pressure and stress are real. You have heavy workload such as assignments, exam, presentations, and sometimes it feels like everything is just too much for you. If that stress is not managed properly, it can lead to mood disorders like depressions or anxiety. Lack of rest also can trigger mood disorders. Second, self-awareness and peer support are powerful. If you know the symptoms, you can notice and recognize the early signs in yourself or your friends, and that awareness can help you seek help before things get worse. Third, you can help reduce stigma around mental health. Learning about mood disorders encourages openness and helps break the stigma or shame often associated with mental illness. This is because mental health is often seen as something shameful to talk about. But if you speak up, you make it easier for others to do the same. And that is how we create a supportive and understanding student community. Lastly, improve academic and social performance. Stable emotions is equal to better focus and performance. Emotionally stable students are more focused, motivated, and able to engage positively in both studies and campus life. Because when your emotions are balanced, you can think more clearly, sleep better, and focus in class. That means better results and a more enjoyable experience during your studies. So, you see, learning about mood disorders is not just interesting knowledge. It is something that can really change your life and the lives of people around you. Now, let's look at the symptoms of mood disorders, which are mostly seen in two major types: depression and bipolar disorder. These are things that you or your friends might be experiencing without realizing it is something serious. Symptoms of depression are known as major depressive disorder. Feeling persistent sadness, emptiness, or hopelessness. You loss of interest in daily activities or hobbies because you no longer enjoying things you used to love. Constant tiredness or lack of energy, having trouble sleeping, either you sleep too little or too much, feeling worthless, guilty, or like a burden to others, having difficulty concentrating, remembering, or making decisions, having thoughts of self-harm or suicide. You need to remember these symptoms must last for at least 2 weeks to be considered part of a mood disorder. Even if there is just one or two symptoms, if they affect your daily life, it is still serious and needs attention. In bipolar disorder, during the manic phase, the symptoms include feeling overly excited or happy for no clear reason, talking very fast with racing thoughts, taking big risks or impulsive decision making like spending a lot of money without thinking. You skip sleeping as you feel like you just need little to no sleep without feeling tired, feeling like you are more powerful or talented than usual, engaging in excessive or unrealistic activities. These symptoms may sound fun at first, but they often followed by depressive episodes, which is similar to the symptoms I mentioned earlier in major depressive disorder. To summarize, major depressive disorder only involves low modes which are just the depressive episodes, while in bipolar disorder, the person experiences both extremes, which are emotional highs known as manic episodes and emotional lows or depressive episodes. That is why we call it bipolar, two poles, two extremes. I hope now you can see how important it is to be aware of your emotional health. Okay, that is all from me. Thank you for listening. Now I will let Afza to take over.
Hi, I am Afza. So, mood disorder like depression and bipolar disorder don't have just one cause. They develop from a mix of factors such as biological, psychological, and environmental factors. In this talk, I'll go over some of the key causes and risk factors that can contribute to this condition and make certain individuals more vulnerable than others. So the first factor is about the biological factors, which is first is the heritability. When we talk about mood disorders such as depression and bipolar disorder, one of the key things to understand is that they often run in families. In fact, research shows that this condition can be highly heritable. Twin studies, which are especially useful for studying the role of genetics, suggest that the heritability of mood disorder can range from 60% to 80%. So this is particularly evident in bipolar disorder where the genetic contribution appears to be especially strong. What this means is that if someone in your immediate family has a mood disorder, your own risk of develop the mood disorder can be significantly higher compared to someone without that family history. So next, in a biological factor also, we have the neurotransmitter dysregulation. Another major factor involves neurotransmitters, which are the brain's chemical messenger, right? So in people with mood disorder, these chemicals, especially dopamine, serotonin, and norepinephrine, can become imbalanced. For example, low level of serotonin are often linked to depression, while excessive of dopamine activity might be involved in the manic phases of bipolar disorder. So this imbalance can affect mood, energy levels, sleep, and even how we perceive the world around us. So next is about the brain structure and function. Finally, let's touch of the brain itself, because mood disorder are not just about chemistry, they also involve change in brain structure and function. Studies using brain imaging have shown that individuals with mood disorder often show abnormalities in key areas such as the hippocampus, which is involved in memory and stress regulation, the amygdala, which plays a role in processing emotions like fear and anger, and the prefrontal cortex, which is crucial for decision making and impulse control. So this change can contribute to the emotional heights and low that characterize mood disorder. So the first factor is about the biological factors, which is first is the heritability. When we talk about mood disorders such as depression and bipolar disorder, one of the key things to understand is that they often run in families. In fact, research shows that this condition can be highly heritable. Twin studies, which are especially useful for studying the role of genetics, suggest that the heritability of mood disorder can range from 60% to 80%. So this is particularly evident in bipolar disorder, where the genetic contribution appears to be especially strong. What this means is that if someone in your immediate family has a mood disorder, your own risk of develop the mood disorder can be significantly higher compared to someone without that family history. Stressful life events. So let's face it, life can be tough sometimes, and for some people, this tough experience can trigger serious mental health challenge, depressive of the life, daily life are often linked to stressful life events. So this could include things like the loss of a loved one, divorce, serious financial problems, or even chronic stress at work or home. When these kinds of events happen, they can overwhelm a person's ability to cope, especially if they already have a genetic or biological vulnerability to mood disorder. It's not just about the event itself, but how it's experienced and processed emotionally. So how it will affect the mood disorder. Also involve the lack of social support. Human beings are social by nature. We thrive on connection, empathy, and being understood. So it's no surprise that loneliness or strained relationship can make us more vulnerable to mood disorder. When someone doesn't have a strong support system, whether it's family, friend, or a community, they may struggle more when facing challenge. A lack of emotional support can make a feeling of sadness, worthlessness, and hopelessness feel even more intense and isolating, which can contribute to a worsened depressive symptoms. So let's move to the childhood adversity. The early years of life are incredibly important for shaping mental health. Unfortunately, experiences such as abuse, neglect, or growing up in a dysfunctional or unstable home can have lasting effect. So this kind of childhood adversity can disrupt emotional development and increase the risk of mood disorder later in life. It's like planting a seed of vulnerability. When a child grows up without safety, love, or consistency, their brain may develop patterns that make it harder to manage emotion or stress as they get older. The first one is the cognitive distortions. So another major factor in mood disorder, especially depression, is how we think. Many people with depression experience what psychologists call cognitive distortion. These are habitual ways of thinking that are overly negative, unrealistic, or self-critical. For example, someone might constantly think, "I'm a failure," or "things will never get better," even when there's evidence to the contrary. Over time, this kind of pessimistic thinking, low self-esteem, and negative self-talk can not only trigger depression but also keep it going. It's like being stuck in a loop of mental habits that reinforce the very feelings you're trying to escape. So next, let's move to the personality traits. Certain personality traits can also make someone more vulnerable to mood disorder. One of the most well-known is neuroticism. neuroticism, which refers to a tendency to experience negative emotion more intensely and more frequently. People high in neuroticism may react more strongly to stress and may struggle more with anxiety and mood swings. Another important trait is perfectionism, especially when it's excessive or rigid. While striving for excellence can be a strength, perfectionism becomes a problem when a person constantly feels like they're never good enough, or when the fear of making mistakes leads to constant pressure and self-criticism. Both of these traits can contribute to the development and persistence of mood disorder over time. Okay, so next, let's move to the substance use, medical condition, and medication factors. It's also important to remember that mood disorders don't exist in a vacuum. They can be influenced and sometimes triggered by physical health and lifestyle factors. One major contributor to substance use, people may turn to alcohol, stimulants, or other drugs as a way to cope with emotional pain or stress. But ironically, these substances can actually worsen mood disorder over time. For example, alcohol is a depressant, which means it can deepen feelings of sadness or hopelessness. Stimulants like cocaine or even some ADHD medication can heighten anxiety or trigger manic symptoms in vulnerable individuals. In addition, chronic illness such as diabetes, cancer, heart disease, or chronic pain condition can take a huge emotional toll. Living with a serious medical condition can affect daily functioning, independence, and quality of life, often leading to increased stress, fatigue, and feeling of helplessness. All of which may contribute to depression or anxiety also. Lastly, some prescription medication themselves can affect mood as a side effect. For instance, certain blood pressure medication, hormonal treatments, or even corticosteroids have been known to trigger mood change in some individuals. That's why it's so important for both patients and doctors to be aware of how physical treatment can interact with mental health, which is related to mood disorder.
My name Najwa and I will talk about impact of mood disorder. Let's start with how mood disorder can affect someone by emotional and psychological. For someone dealing with depression, they're not just feeling sad, but they also can feel emotional shutdown, which is they feel deep hopelessness, grief, or even numbness. Things that used to bring joy before, not anymore. They can feel like there's a constant emotional weight that can't be shaken off. Now, on the opposite side to depression, someone with the bipolar disorder may experience extreme high, we also call as mania episode. Imagine feeling super energetic, overly confident, like nothing can go wrong, right? Maybe it sounds good, but it's not, because it can be dangerous, which is it can lead to impulsive decision or risky behavior without realizing the consequence of the action. And the sudden mood change. It's not like when we being moody because of we can't get what we want. It's like emotional roller coaster which can exhausting and confusing for the person experiencing it or the people around them. Now let's talk about what mood disorder to our thinking, or what we call as cognitive impact. People might struggle to focus, forget things, or take way longer to make decisions. It's often described as brain fog. Even simple tasks can feel overwhelming. However, they also might slow in thinking and speech in daily life. In depression, this thought can get really dark because it can lead to self-criticism or even thought of not waiting to be here anymore, like suicide, because they think they are worthlessness. In mania, the brain goes in the opposite direction to depression, which their thought race so fast until they keep up. They might feel unstoppable. They're not thinking things incorrectly, which can lead to big mistake in their life. Their attention and concentration also disturbed. They are unable to focus. They often find it very challenging to sustain attention on tasks, conversation, or reading material. Their minds may wander easily. Besides that, during many episodes, extreme distractibility is common, where individuals are easily pulled away by irrelevant stimuli. In depression, difficult focusing can also be a form of distractibility, as internal negative thought or physical discomfort pull attention away. They are also difficult to maintain alertness over extended period, leading to error or missing important detail. As we know, they also have memory problem, which they difficult to hold memory and manipulating information in their mind for short period. Other than that, they are unable to recalling specific event or experience from their past. Then they also have difficulty in learning and remembering new verbal information. Then, when they in depression, the overall slowing of mental process can contribute to slower retrieval of memories. They also have difficulty in making choice, even simple one. This can range from indecisiveness in depression to reckless and impulsive decision making in mania. Struggle with identifying problem, generating solution, and implementing them effectively. They can organizing planning tasks and managing time effectively, which leading to disorganization and missed deadline. Difficulty shifting between different tasks and tasks or adapting to new information or changing situation. You might think mood disorder only live in the brain, but they also can hit the body too. Sleep is a number one that can be affected. Some people can't sleep at all, but others might sleep way too much than normal. You might thinking for mania, right? Because we know how energetic they are. So for mania, they can not sleep at all for a day and not even feel tired, which is not feel normal for us, right? Of course, normal person like us need to sleep. However, appetite also can change too. They might not eat anything in a day, which is they not feeling hungry at all. And of course, it lead to sudden lose weight, which not good for their physical, but they also can eat so many than normal person. Yes, they will gain weight quickly. That's not good because obesity might come to them. However, they also can feel tired every day. Even if they sleep for a long time, they might still feel no energy at all to do anything, like exercise. So it can lead to weaker muscle and honestly more worse for their health. Over the time, it can increase the risk of real medical problem like chronic heart disease. Individuals with mood disorder, especially depression, have a significantly higher risk of developing various cardiovascular disease, including heart attack, stroke, coronary artery disease, and hypertension. It came from lifestyle, which depression can lead to inactive lifestyle, poor diet, smoking, and substance abuse. Other than that, it also came from psychological change, which means chronic stress and inflammation associated with mood disorder can directly impact cardiovascular health. Lastly, let's look how mood disorder also affect the way people act and connect with others or their behavior and social. A lot of people start pulling away from friends and family, not because they don't care, but because they are overwhelmed. But the more they isolate, the more alone they feel, and it becomes a tough cycle to break from their health. In mania episode, behavior can get risky. Things like reckless spending, dangerous driving, or gambling. Things that have serious consequence to their life. And once the episode pass, it often followed by a lot of regret from their past action. However, at school, place or workplace, their performance might drop too. Their concentration is hard to concentrate and their motivation disappear in their life because no social between colleagues. And sometimes people just stop showing up in their life. It's not because they are lazy, but because they are struggling with depression or bipolar that lead them to have those behavior. Impact of work can lead absenteeism and presenteeism. Absenteeism is when individuals with mood disorder often miss day of work or school due to overwhelmed symptoms like severe fatigue, anhedonia, which is loss of interest, profound sadness, or the physical discomfort associated with depression. For example, headaches, stomach issue. During mania episode, impulsivity might lead to neglecting responsibility. However, in presenteeism is when physically present, individual may be unable to perform their usual capacity. Their focus, concentration, and energy levels are severely compromised, leading to reduced productivity and error. So, as you can see, the impact of mood disorder is not just one thing. It's everything. Emotionally, mentally, physically, socially. It touches every part of a person's life. And that's why understanding this impact matters to all of us. So we can support, not judge. So we can notice the sign and to help someone through it. Thanks for listening.
Hi, I'm Arisha. Now, I would like to talk about treatment and example of mood disorder. There are several treatments of mood disorder, such as medication, psychotherapy, and lifestyle changes. First medication treatment is antidepressant. Antidepressants are the most commonly used medicine to treat depression and depressive episodes in bipolar disorder. They work by changing brain chemicals, especially serotonin, which help control mood, sleep, and emotion. Different antidepressants affect the brain in different ways. It usually takes about 4 to 6 weeks before the medicine starts to improve symptoms because the brain needs the time to adjust. Some common antidepressants are citalopram, sertraline, and fluoxetine. This drug increase serotonin level in the brain, which can help lift a person's mood and reduce feeling of sadness, low energy, and hopelessness. Next, mood stabilizer. Mood stabilizer are medications that help control and regulate mood swings, especially in people with mood disorder, like bipolar disorder. They work by reducing abnormal activity in the brain, helping to keep a person's mood more stable over time. One of the most commonly used and well-known mood stabilizer is lithium. Lithium is one of the most effective and most studied mood stabilizer in psychiatry. It has been used for decades and is known to prevent both manic episodes and depressive episodes, making it very helpful for long-term mood management. However, mood stabilizers need to be taken under close medical supervision because they can affect other parts of the body like the kidney or thyroid. Last medication treatment is antipsychotics, also called neuroleptic, are medicine used to treat several mood problems, especially during mania, psychosis, or depression that doesn't improve with other treatment. They are often given along with antidepressant or mood stabilizer, but can sometimes be used alone. This drug work by balancing brain chemicals like dopamine, which affect mood and behavior. Common antipsychotics include aripiprazole, risperidone, and olanzapine. They help manage symptoms such as extreme energy, impulsive behavior, hallucination, or delusion. Antipsychotics must be taken under a doctor care because they can cause side effects like weight gain, sleepiness, or movement problem. Next treatment and example of mood disorder is psychotherapy. First psychotherapy is cognitive behavioral therapy, CBT. CBT is a type of thought therapy that helps people change negative thought and behavior that cause emotion problem. It is commonly used to treat conditions like depression, anxiety, and bipolar disorder. Instead of focusing on the past, CBT helps people solve current problems by teaching them to recognize harmful thoughts, replace them with more realistic ones, and learn better ways to cope and plan. Some examples of CBT techniques are breathing exercise and muscle relaxation to reduce stress, as well as learning skills to handle difficult emotions and everyday challenges. CBT usually involves weekly sessions with a trained therapist and includes practice exercise to do at home. Other than that is dialectical behavior therapy, also known as DBT. DBT is a type of thought therapy based on cognitive behavioral therapy, but it is specially designed for people who feel emotion very intensely, such as those with mood disorder or self-harming behavior. The main goal of DBT is to reduce harmful behavior, help people control their emotion better, and improve their relationship. Some common DBT techniques include mindfulness, like a simple 5-minute daily breathing exercise to help stay calm and aware, and distress tolerance skill called TEEP, which stands for temperature change, intense exercise, paced breathing, and progressive muscle relaxation, all used to help calm down quickly during strong emotion moments. Psychodynamic therapy. Psychodynamic therapy is a type of thought therapy that believes a person's behavior and mental health are influenced by early life experience, especially from childhood. This therapy helps explore hidden thoughts, unresolved conflict, and strong emotions that affect the person's current feeling. It usually lasts longer than other therapies and focus on helping the person understand the deeper reason behind their emotion and action. One common technique is when the therapist encourages the person to talk freely about their thoughts, such as their relationship, dreams, or childhood memory. Next treatment, an example of mood disorder is lifestyle changes. They have three. First is regular exercise. Regular exercise is a natural and effective way to improve mental health. It has strong positive effect on mood and is especially helpful for people with depression, anxiety, and other mood disorder. The general goal is to aim for at least 30 minutes of physical activity per day, 2 to 3 times a week. One of the most recommended type is aerobic exercise, such as walking, jogging, cycling, or swimming. This activity helps boost heart rate and improve mood quickly by increasing feel-good chemicals in the brain, like endorphin and serotonin. Regular exercise also helps reduce stress, improve sleep, and build emotion resilience over time. Next, balanced diet. A balanced diet plays an important role in managing and supporting the treatment of mood disorder. While food alone cannot cure this condition, getting the right nutrient can help stabilize the mood and support overall mental well-being. For example, complex carbohydrates help regulate serotonin level, which affect mood, while fruit and vegetables are rich in antioxidants and vitamins that support brain health and reduce inflammation. Lastly is family therapy. Family therapy provides professional support that help both the person with the mental health condition and their family members. It focuses on improving the overall family dynamic, not just treating the individual. This type of therapy can help improve communication, resolve conflict, and provide better support for family members living with a mental health disorder.